Hello and welcome to True Pathfinder, your portal to health and truth. And in this video we are going to look at a health condition that affects millions and millions of people, namely urinary tract infections and incontinence. We're gonna discuss the causes, the symptoms and some natural ways in which you can treat it. So, without further ado, let's dive right into it. Urinary tract infections are some of the most common bacterial infections in the world. They affect 150 million people each year worldwide. In 2007, in the United States alone, there were an estimated 10.5 million doctor's office visits for UTI symptoms, constituting about 0.9% of all ambulatory visits, as well as 2 to 3 million emergency department visits. Currently, the societal costs of these infections, including healthcare costs and time missed from work, are adding up to about $3.5 billion per year in the US alone. Additionally, UTIs are a significant cause of morbidity in infant boys, older men, and women of all ages. Serious sequelae include frequent recurrences, pyelonephritis with sepsis, renal damage in young children, preterm births, and complications caused by regular antimicrobial use such as high-level antibiotic resistance and Clostridium difficile colitis. In the United States, 70 to 80% of complicated urinary tract infections are attributable to indwelling catheters, and they account for about 1 million cases per year. Catheter-associated UTIs, also known as CAUTIs, are associated with increased morbidity and mortality and are collectively the most common cause of secondary bloodstream infections. Risk factors for developing a catheter-associated UTI include prolonged catheterization, older age, and diabetes, as well as female gender. Patients that suffer from a symptomatic UTI are commonly treated with antibiotics. The problem is these treatments can result in long-term alteration of the normal microbiota of the vagina, as well as the gastrointestinal tract, and the development of multi-drug resistant microorganisms. The availability of niches no longer filled by the altered microbiota can also increase the risk of colonization with multi-drug resistant UROPATHOGENS. Notably, the golden era of antibiotics is waning lately, and there is therefore a need for rationally designed and alternative treatments. Recent studies have used, therefore, for example, RNA sequencing to directly analyze the uropathogens from the urine of women that experience symptomatic UTIs to come up with different solutions. One of the main symptoms of UTIs is Stranguria, also known as vesicaltenesmus, and this describes a symptom of unintentional, agonizing micturition of small volumes of urine or a marked desire to urinate, often without any urine being passed. In many cases, the bladder is actually empty or nearly empty. Western medicine always considers the pathogenesis to be induced by different types of bacteria, malign or benign growth, as well as inflammations. Some of the diseases and causes of Stranguria are urolithiasis, especially when the calculus is lodged in the vesico-uretic junction, the urinary tract infections, of course, malignancy of the urinary tract, bladder perforation, post-operative repair of vesicouretic reflux, kidney stones, prostate cancer, cystitis, chlamydia, renal colic, epididymitis, gonorrhea, prostatic hypertrophy, benignant, orchitis, pyelonephritis, trichomonas, urethritis, vaginitis, and many more. This is not an exhaustive list, and it is highly recommended that you consult with your healthcare practitioner to figure out what the real cause is. You can also, of course, as always, contact us at christine.doctor, link in the description box below, and we will evaluate the real cause of your UTI or Stranguria. Next, let's look at the causes of UTIs, the Western medical mainstream explanations, and other explanations that are often not talked about and overlooked by mainstream medicine. But before we do that, short reminder, if you enjoy our content, please consider supporting us directly by becoming a Patreon from as little as $5 per month. Link is in the description box below, and your support is very much appreciated. Also, do not forget to like, share, subscribe if you're not already, and comment to help the channel grow and spread the truth. For the holistic care you need and deserve, as mentioned, do not hesitate to contact us at christine.doctor and check out some of the most powerful holistic health devices available on the market today at vibrantbody.net. Links are also in the description box below for you. So, the medical explanation for UTIs is that a range of pathogens causes it. Most commonly cited are Escherichia coli, Klebsiella pneumonia, Proteus mirabilis, Enterococcus fecalis, and Staphylococcus saprophyticus. High recurrence rates and increasing antimicrobial resistance among uropathogens threaten to improve the economic burden of these urinary tract infections significantly. And therefore, in this review, we will discuss how basic science studies elucidate the molecular details of the crosstalk that occurs at the host pathogen interface, and the consequences of these interactions on the pathophysiology of UTIs. We will also describe current efforts to translate this knowledge into new clinical treatments for UTIs. The urinary tract infections are caused by a wide range of pathogens, including gram-negative and gram-positive bacteria and fungi. Uncomplicated UTIs typically affect women, children, and elderly patients who are otherwise healthy. Complicated UTIs are usually associated with indwelling catheters, urinary tract abnormalities, immunosuppression, or antibiotic exposure. The most common causative agent for uncomplicated and complicated UTIs is the uropathogenic Escherichia coli, or UPEC for short. For complicated UTIs, the other causative agents are, in order of prevalence, Enterococcus, SPP, K, pneumonia, Candida, SPP, S. aureus, P. mirabilis, P. aeruginosa, and GBS. For uncomplicated UTIs, other causative agents are, again in order of prevalence, Klebsiella pneumonia, Staphylococcus saprophyticus, Enterococcus fecalis, Group B, Streptococcus, also known as GBS, Proteus mirabilis, Pseudomonas aeruginosa, Staphylococcus aureus, and Candida spp. Well, we here disagree with this simplistic picture that matches the old germ theory that is still prevalent in modern medicine. To elucidate this dilemma, let's learn more about anatomic, physiologic and etiologic history of UTIs and Stranguria. So let's start by looking at what is known as the bladder trigone. That is the triangular area between the ureters and the urethra openings. When the bladder muscle contracts, the trigone funnels urine temporarily stored in the bladder into the urethra. Equal to the intestinal cells that digest and absorb food, the biological function of the bladder trigone is to digest proteins and absorb urine. The submucosa of the bladder trigone consists of intestinal cylinder epithelium that originates from the endoderm and is therefore controlled by the brainstem. So the bladder trigone is controlled from the left side of the brainstem, to be precise, next to the control center of the rectum submucosa. And this bladder trigone, the Bartholin's glands and the smegma-producing glands share the same brain relay, as can be also seen from the picture here on the right. The biological conflict linked to the bladder trigone is an ugly, dirty morsel conflict, so dirty business, dirty tricks, dirty sects, all of this related to the sigmoid colon and rectum submucosa. During the conflict-active phase, the cells in the bladder trigone proliferate proportionally to the intensity of the conflict, and the biological purpose of the cell increase is to improve the ability to digest or absorb the dirty morsel. A flat, so absorptive type or cauliflower-shaped growth of secretory type forms in the trigone with prolonged conflict activity, and in conventional medicine this is often diagnosed as bladder cancer. If the rate of cell division exceeds a specific limit, the cancer is considered to be malignant. Below that limit, the growth is regarded as benign or diagnosed as a so-called bladder polyp. In the healing phase, so following the conflict resolution, fungi or mycobacteria such as TB bacteria remove the cells that are no longer needed, and this causes purulent tuberculosis, cystitis, so a bacterial bladder infection. And healing symptoms are pain due to the swelling, cloudy urine, potentially blood in the urine, as well as night sweats. Depending on the degree of the conflict-active phase, the symptoms range from mild to severe. When fungi participate in the healing process, this causes candida cystitis, which can become chronic when a person is in a hanging, so a relapsing conflict-active phase, so the conflict is not being healed. Contrary to the claims of conventional medicine, the fungal infection in the bladder trigone cannot spread to other areas in the urinary tract, such as the ureters, the bladder, or the urethra, because fungi don't cross the germ layer threshold. If the required microbes are unavailable upon the resolution of the conflict because they were destroyed, for example, through an overuse of antibiotics, the other cells remain, and eventually the growth becomes encapsulated with connective tissue. This is usually diagnosed as a bladder polyp or a benign cancer. Now let's also look at the bladder mucosa and the urethra. The bladder and the urethra comprise the lower urinary tract. As you can see also in the picture on the right, and in females the bladder lies in front of the uterus and the urethra is positioned near the front wall of the vagina. In males, the urethra extends to the end of the penis and carries urine as well as semen during ejaculation, and at the neck of the bladder the urethra is surrounded by the prostate. The bladder is a hollow muscular organ where the urine from the renal pelvis and the ureters is temporarily stored, and the urine exits the bladder through the urethra. The inner wall of the urethra is endowed with smooth and striated muscles. And just like the intestinal muscles that move the food morsel along the intestinal canal through peristaltic motion, the smooth muscle of the urethra facilitates the flow and elimination of the urine morsel. The lining of the bladder and urethra consists of squamous epithelium, which originates from the ectoderm and is therefore controlled by the cerebral cortex. Initially, the urinary system consisted of two bladders. Over time, however, the two bladders grew together, forming one single organ. Conversely, by the way, the kidneys were at first one organ, which later divided into two. And therefore, the bladder and the urethra have two brain control centers, one on each brain hemisphere. As you can see also in the picture here at the bottom right. The epithelial lining of the bladder and the urethra is controlled by the so-called temporal lobe, which is part of the postsensory cortex. And the left half of the bladder and the left half of the urethra are controlled from the right temporal lobe, and the right half of the bladder and right half of the urethra are controlled from the left cortical hemisphere, next to the control center of the rectum lining. And hence, as you can see, there is a crossover correlation from the brain to the organ. The bladder, urethra, renal pelvis and ureters share the same control centers in the brain, and therefore when the conflict affects the renal pelvis, the ureters, bladder or urethra, it is random, and the same brain relays also control the prostatic and ejaculatory ducts. In line with evolutionary reasoning, territorial conflicts, sexual conflicts, and separation conflicts are the primary conflict themes associated with organs of ectodermal origin that are controlled by the sensory premotor or post-sensory cortex. During the conflict active phase, the ulceration in the bladder mucosa and the lining of the urethra are proportional to the degree and duration of conflict activity, and the biological purpose of the cell loss is to enlarge the volume of the bladder and to widen the urethra to improve the urine flow to better be able to mark the territory. This CT scan here on the right shows two hammer foci in the left temporal lobe, one in the brain relay for the bladder mucosa and the other in the rectum relay, which are the upper red arrows. And the sharp borders reveal that a person is in the conflict active phase with in a marking conflict, so not being able to establish your boundaries, and an identity conflict, so the question of where do I belong. The biological special program of the bladder mucosa and urethra follows the outer skin sensitivity pattern with hypersensitivity during the conflict active phase and hypersensitivity in the healing phase. During the first part of the healing phase, the tissue loss is replenished through cell proliferation with swelling due to the edema, so the fluid accumulation in the healing area. In conventional medicine, this might be diagnosed as a bladder cancer or so-called urothelial carcinoma, also called transitional cell carcinoma. The new cells cannot be regarded as cancer cells per se, since the cell increase is a replenishing process. Small wart-like growth in the lining of the urinary tract, including the renal pelvis and ureters, is referred to as urothelial papilloma and is usually considered to be benign. Healing symptoms are frequent urges to void with burning pain during urination and elimination of only small amounts of urine. There is also potentially blood in the urine, and typically is also the feeling of constantly needing to urinate, as well as incomplete emptying of the bladder following urination, and a condition termed bladderinfection. With water retention due to the kidney syndrome, the enlarged swelling might even block the urine flow completely in the urethra. And this is an acute medical situation. In this case, a temporary bladder catheter might indeed be needed. A urinary tract infection in the urethra or a bladder infection indicates that the bacteria assist in the repair and scarring process, and this is usually the case when the ulceration in the conflict active phase reaches deep into the urethral and bladder tissue. Recurring bladder infections point to conflict relapses triggered by setting on a track established when the regional marking conflict occurred. Urethral gonorrhea is an inflammation of the mucous membrane of the urethra with a discharge due to the activity of the bacteria during the healing process. If Chlamydia trachomatis bacteria are involved, this causes a so-called chlamydia infection. Chlamydia bacteria are also involved in urethritis. So chlamydia in the mouth here relates to an oral conflict, and in the rectum or anus to an identity conflict. And contrary to common beliefs, gonorrhea or chlamydia cannot be sexually transmitted since the symptoms are already healing symptoms explicitly of a territorial marking conflict regarding the sexual space. If the symptoms are less severe, the condition might be diagnosed as urethritis or cystitis, euphemistically termed honeymoon cystitis, caused by frequent and prolonged sexual intercourse. In men, the urethra is also used for ejaculation, and hence the biological special program of the urethra corresponds also to an ejaculation conflict. So not being able or not being allowed or not wanting to ejaculate or having premature ejaculations. Bladder warts are the result of a prolonged healing in the urinary bladder, and erroneously these harmless residues are often interpreted as cancers. Bladder warts are also, by the way, very common in cats and dogs. Next on the list are the bladder muscle and the external bladder sphincter. So let's see what the biological conflicts that cause those problems are. The bladder wall consists of muscles which contract during urination, forcing thereby the urine out of the bladder into the urethra. At the same time, the two sphincters open to allow urine to be expelled. The external bladder sphincter surrounds the lower end of the urethra and is, in addition to the internal bladder sphincter, a second muscular mechanism that regulates the elimination of urine. The striated bladder muscle and external bladder sphincter derive from the new mesoderm and are controlled from the cerebral medulla and the motor cortex. Originally, the bladder consisted only of smooth muscles that developed from intestinal muscles of the gullet. The striated muscles of the bladder developed later together with the external bladder sphincter, and both are voluntary muscles that can be consciously controlled. The striated bladder muscle and external bladder sphincter have two control centers in the cerebrum. The trophic function of the muscles responsible for the nutrition of the tissue is controlled from the cerebral medulla, and the contraction of the muscle is controlled from the motor cortex, which is part of the cerebral cortex. The right half of the bladder muscle and external bladder sphincter are controlled from the left side of the cerebrum. The left halves are controlled from the right cerebral hemisphere, and hence there is a crossover correlation from the brain to the organ. In comparison, the smooth muscles of the internal bladder sphincter are controlled from the midbrain. The bladder muscle and external bladder sphincter, as well as the rectum muscles and external rectus sphincter, the cervix muscles and cervical sphincter, and vaginal muscles all share the same brain relays, as you can see also from the picture here on the right. The biological conflict that is linked to problems with the bladder muscle and the external bladder sphincter is the inability to mark one's place sufficiently. This type of conflict typically occurs when a territorial marking conflict cannot be resolved for an extended time, and the bladder muscles also relate to a self-devaluation conflict that is usually brought on by urinary incontinence. During the conflict active phase, we observe cell loss or necrosis of the bladder muscle tissue that is controlled from the cerebral medulla and proportional to the degree of conflict activity and increasing paralysis of the bladder muscle that is controlled from the motor cortex. At the same time, the external bladder sphincter opens, which increases the flow of urine to better be able to mark the territory. The striated muscles belong to the group of organs that respond to the related conflict with functional loss, just like the biological special programs of the islet cells of the pancreas, the inner ear, the olfactory nerves, and hyperfunction. Urinary incontinence, so an involuntary outflow of urine, indicates a persistent marking conflict that is still unresolved. Depending on the intensity of the conflict, the condition ranges from mild leaking, when you cough, for example, or sneeze or laugh, to uncontrollable wetting. When the bladder sphincter opens, a sudden urine outflow occurs during the epileptoid crisis, and incontinence often generates self-devaluation conflicts that involve adjacent tissues such as the pubic bone or the pelvic floor muscles. Hence, weak pelvic floor muscles don't cause incontinence, but are instead a result of continuing bladder-related self-devaluation conflicts. And the same holds true for recurring bladder infections. When it comes to the external sphincter, so the external bladder sphincter, rectal and cervical sphincter, they consist of striated muscles. In contrast, internal sphincters, such as the internal bladder sphincter and internal rectal sphincter, consist of smooth muscles. External sphincters have an inverse innervation, meaning that they close through a contraction in vagotonia, i.e. in the healing phase, and open through relaxation in sympathicotonia, i.e. in the conflict active phase and epileptoid crisis. Regarding the bladder and rectum during an epileptoid crisis, for example during an epileptic seizure, both sphincters might open simultaneously, causing a complete emptying of the bladder and involuntary loss of stool. Children can also suffer territorial marking conflicts with their siblings, for example, or schoolmates, or when they are physically, verbally, or socially bullied. And this is what we observe then as bedwetting or nocturnal enuresis. During the healing phase, the bladder muscle is reconstructed and the bladder sphincter closes. If bacteria assist healing, this causes a bacterial bladder infection with painful bladder spasms during the epileptoid crisis. And all organs that derive from the new mesoderm, the so-called surplus group, including the bladder muscle, show the biological purpose at the end of the healing phase. After the healing process has been completed, the organ or tissue is more robust than before, which allows you to be better prepared for a conflict of the same kind in the future. Now that we have discussed the psycho-emotional causes, the biological conflicts that cause urinary tract infections and Stranguria, let's move on to the explanations that traditional Chinese medicine has to offer us and some natural solutions that they have. Traditionally, UTIs are known in TCM as Lynn syndrome, and Lynn syndrome is subdivided into 5 types. C-Lynn, so Stranguria due to urinary stones, Chi-Lynn, meaning Stranguria due to Qi stagnation or Qi deficiency, Xu-Lynn, Stranguria complicated by hematuria, Gao-Lynn, Stranguria complicated by chyluria, and Laolin, which is Stranguria due to overworking. The major causative factor for the Lin syndrome is the stay and stagnation of damp heat at the lower burner or the lower warmer. The damp heat may be derived from excessive fatty, fried, spicy and hot food consumption or from the excessive consumption of alcohol. At the chronic stage, the Lin syndrome is mostly connected with the deficiency of the spleen and the kidneys. And another factor is the excessive liver fire stagnates or affects the function of the lower burner, which causes Qi-Lin. So let's go through each one of these 5 subcategories and the natural solutions. Starting off with Qi-Lin or Re-Lin. Indications here are painful and scanty urine or with small stones in the urine or an obstructed feeling when urinating, and the oppression and pain sensation at the lower abdomen, as well as twitching or spasmodic pain of the lumbar regions, oliguria with reddish urine, a red tongue, tongue with thin yellow coating, and a rapid pulse. For treating this condition, we need to clear the damp heat, and we also have to work on the diuretic function to eliminate the stones. And the products that are recommended here are Ba-Zheng-San, also known as the dianthus formula. This is the first choice formula for dysuria and oliguria due to damp heat at the lower burner. For Qi-Lin, so Stranguria due to Qi stagnation or Qi deficiency, the indications are for the Qi stagnation type, dysuria, oliguria, full and extended feeling of the lower abdomen, a green or purplish tongue, and a deep wiry pulse. And for the Qi deficient type, heavy and dropping feeling of the lower abdomen or pain in the abdominal area, as well as dysuria, a dripping discharge of urine after urination, a pale face and tongue, and a weak and thready pulse. Treatment and formulas recommended here. For the Qi stagnation type, we need to regulate the stagnated Qi and harmonize the liver, and for the Qi deficient type, we need to tonify the middle Qi, so the Qi of the spleen and the stomach. And the products recommended for that are Wu Yao Shun Qi San, also known as the Lindera formula. This is for the dysuria of the Qi stagnation type. And Buzhong Yi Qi Tang, ginseng and astragalus combination, that is very good for the dysuria of the Qi deficient type. For Qi-Lin, so Stranguria that is complicated by hematuria, the indications are in a damp heat type, hot, burning and painful sensation when urinating, reddish urine or blood clots that you can see in the urine, as well as sharp and spasmodic pain or restlessness, a yellow coating of the tongue and rolling, as well as rapid pulse. For the kidney yin deficiency type, so the chronic stage of the above type, pale or light reddish urine, sore and weak sensation at the lumbar regions, fatigue, a light red tongue, and thready as well as rapid pulse. Treatment and formulas here. For the damp heat type, we need to clear the damp heat and cool the blood, as well as stop the bleeding. For the kidney yin deficiency type, we need to tonify the kidney yin and clear the deficient heat to stop the bleeding. Products that are recommended: Shao Ji Yin Zi, that is a typical formula for hematuria due to damp heat, and its ingredients are as follows. We have raw Rehmannia, 90%, then small thistle, 14%, typhoid pollen, 8%, lotus notes, 8%, talcum, 14%, akebia, 6%, lopatherum, 8%, gardenia fructus, 8%, Chinese angelica, 8% and licorice 6%. Then we also have the lotus seed combinations, also known as Lan Chi Ching King Xin Yin. That is to clear the heat of the heart and its connected food organ, which is the small intestine. Both heart and small intestine are connected with Stranguria, complicated by hematuria. Then we have Dang Gui Lung Huang Tang. It's a strong formula for clearing the heat in the San Jiao, so the triple burner, to cool down the blood heat and stop the bleeding. And then we have Qi Po Ba Wei Wan. This is a very good formula to treat Stranguria due to the kidney yin deficient type. For Gao Lin, which is the Stranguria complicated by chyluria, the indications are for the damp heat type, turbid white urine, dysuria, burning and pain sensation when urinating, a red tongue with a greasy coating, and a rapid pulse. For the kidney yin deficient type, the chronic stage of the above type, fatty urine, less burning and pain sensation when urinating, gradual weight loss, dizziness, fatigue, weakness and soreness at the lumbar regions, a pale tongue with a greasy coating, and thready as well as weak pulse. Treatment and formulas that are recommended here: for the damp heat type, we need to clear the damp heat and eliminate the turbid and also ascend the pure essence. For the kidney yin deficiency type, we need to tonify the kidney yin and strengthen the essence storage. Products that are recommended are Ba Cheng San, which is dianthus formula for the damp heat type, and Remania 6 formula for the kidney yin deficient type. Also the Lotus Stamen formula, which is an astringent formula for essence loss due to the kidney deficiency. For Lao Lin, so Stranguria due to overworking, the indications are prolonged and chronic stage of Stranguria of any type, dripping discharge of urine, dysuria, fatigue, a pale tongue, and weak pulse. And also the symptoms get worse when you work or perform any type of physical activity, and better when you rest. We need to tonify the kidney and spleen here, and the products that are recommended to achieve this are Gui Pi Tang, which is a ginseng and longan combination that treats the spleen deficiency type, Huang Qi Jian Chong Tang, which is an astragalus combination that treats spleen weakness, Shenliang Bai Chu San, which is a ginseng and atractolite formula that eliminates dampness by promoting the function of the spleen and the stomach, Ba Cheng Tong that tonifies the qi and the blood, and Feng Ji Huang Qi Tang, a Stephania and astragalus combination that strengthens the spleen and eliminates the dampness. And there are also some formulas specifically for pain problems, so to treat the pain. With all that being said, I hope that you've enjoyed this presentation. If you did so, please support us directly by becoming a Patreon from as little as $5 per month. Link in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to spread the truth and help this channel grow. For the holistic terrain therapy you need and deserve, please contact us at christine.doctor and check out some of the most powerful holistic health devices available on the market today at vibranbody.net. Links in the description box below as always for you. And until next time, stay healthy.